I have to say that I think Western medicine has transformed our lives in the 20th century. The pills and surgery that, largely through public health measures and other things, but it's made the world a much better place for us. In the 21st century, as you well know, there's a whole slew, a tsunami literally of chronic diseases, which were present in the 20th century, but nowhere near the magnitude, even corrected for population, that we're seeing in the 21st century. And when Western medicine applies the same pills and surgery to these chronic diseases, they may be life-saving in the short term and even control the symptoms. In many of the cases, they don't really get to the root cause, and the diseases continue to progress onward, and that's the issue.
This is Doctor Talks.
Hey, Robert. Thanks for joining me. So I have with me Dr. Robert Lufkin. He's a professor, taught medical school, and figured out, much like I did, that a lot of what we learned in medical school and is still being taught is not exactly, the best thing for your health, which is sort of strange coming from, a doctor and a professor and somebody who teaches medical students, author of the best-selling book, Lies I Taught in Medical School. So looking forward to discussing sort of breaking up some of these sort of lies, breaking out some of these lies and seeing how it can really impact our longevity, and sort of let's get right into it. So Robert, thanks for joining us.
Oh, thanks, Jason. This is going to be so much fun. I think this is the first time we've had a back and forth like this, so this will be great. And thanks for writing the foreword to my book, and thanks for all the work you do. It's certainly been an inspiration to me, and you continue to be an inspiration for the work that I do. So,
Thank you. Maybe you can tell us a little bit about sort of your journey here and how you got to this stage. I think both of us sort of trained in the very traditional sort of standard way and eventually came to some very different conclusions than what mainstream medicine had been saying, and sad enough to say, but how did you come to this sort of realization about what helps with health, and go from there?
Yeah, well, it's great. Our paths are very similar. In fact, we even overlapped at UCLA back in the day, I think.
That's
Well,
right.
although we didn't know each other at the time, but we were in the same buildings and stuff then. But yeah, to your point, I'm not a conspiracy theorist. I'm part of the problem. And to be clear, I'm very critical of Western medicine, but I have to say that I think Western medicine has transformed our lives in the 20th century, with the pills and surgery that, largely through public health measures and other things, but it's made the world a much better place for us. And even today, if I get hit by a car, I'm going to want that, blood transfusion and splenectomy and, my bones set. But the problem is, in the 21st century, as you well know, there's a whole slew, a tsunami literally, of chronic diseases, which were present in the 20th century, but nowhere near the magnitude, even corrected for population, that we're seeing in the 21st century. And when Western medicine applies the same pills and surgery to these chronic diseases, they may be life-saving in the short term and even control the symptoms, but in many of the cases, they don't really get to the root cause, and the diseases continue to progress onward, and that's the issue. And my story is, I'd like to say, well, I want to do this to make the world a better place. Well, no, I was actually minding my own business as a professor in medical school, and I was dragged kicking and screaming into it when I came down with 4 of these chronic diseases myself. And I went to my doctor, and they prescribed 4 different medicines for them. And I said, hey, what about lifestyle? And they said, it really doesn't work. You're going to be on these pills for the rest of your life, so get used to it. And at that point, I had young daughters that weren't even in middle school yet, and I knew it wasn't going to end well. So I began to take a deeper dive, and I realized a lot of smarter people than me had been publishing a lot of stuff that changed my understanding and changed the way I thought about this, about these diseases and the ways that we can approach them. So long story short, I adopted some relatively straightforward for me lifestyle changes, and then I was able to reverse those 4 chronic diseases, to the point that I got off the prescription medicines. And now I've sort of made it my mission to help other people understand this message and, not make the same mistakes that I made.
Well, it's so strange, right? Because these are, and I'm not a conspiracy theorist either. I mean, obviously, I trained in, standard Western medicine, but I think that it's very strange that, a physician as a patient, right, can develop these chronic diseases, go to another physician and specialists, obviously, and they give you a treatment, which is medication, when it's in fact a clearly a lifestyle disease, right? So a lot of these diseases we're dealing with now, so type 2 diabetes, metabolic disease, it's very closely related as a lifestyle disease. We know that diet and lifestyle exercise can make a big difference. In fact, every sort of every every lecture on treatment of these diseases starts with lifestyle, right? But it's lip service, right? That's the problem. And I remember talking to, I remember, going to some of these lectures, and they'd be like, oh, they'd say things like, oh, the number 1, 2, and 3 treatments for metabolic disease is lifestyle, 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 right? And then they spend the next 59 minutes of the 60-minute lecture telling you about the drugs that you should be using, right? So it's unfortunate because the medical students and the people in the audience, this was a CME, so it was actually other doctors in the audience, get the clear message that, yeah, we acknowledge that it's lifestyle disease, but we're here to give drugs, right? And that's unfortunate, right? It's so sad. Even if you're a physician yourself, it doesn't matter. That's the message, that's our training. And it's sort of sad that if people want to come and get advice that might help them, they're better off on YouTube and on the internet rather than seeing their doctor, right? And I think that's the part that always strikes me as, this is actually really not the way it's supposed to be, you know?
Yeah, I wish somebody would have said, when I said lifestyle doesn't work, I wish they would have said, yeah, it does work, but most people don't have the willpower or are not able to accomplish it first. And then they'll follow up and say, I mean, one of my diseases was type 2 diabetes, pre-diabetes. I would have liked them then to say, okay, for type 2 diabetes, you can either do lifestyle, which, we find people can't stick with, but that will reverse the disease and it will not progress likely. Or we're going to give you metformin and eventually insulin, and your disease is going to continue to get worse and worse and worse. And you know the story: amputations, renal failure, on and on and on. All the chronic diseases will be amplified. So you could choose. You can end it with lifestyle and really put it to bed, or we'll palliate you. We'll give you insulin so you don't die of hyperglycemia, but you're still progressing, you're still damaging the blood vessels, and it's going on. And I'm preaching to the choir, of course. You know this, of course, better than I do.
What were those things that you did that allowed you to reverse that type 2 diabetes and pre-diabetes?
Yeah, I mean, foundationally was nutrition, but in addition to nutrition, I didn't leave out sleep or exercise or stress, but nutrition was really fundamental. And from your work, it started off with intermittent fasting and controlling when I ate, getting rid of snacks, intermittent fasting, and this thing, and then I changed what I ate. So for me, it was getting rid of carbohydrates, refined carbohydrates, sugar, starches, the drill, lower that as much as possible. And then additionally, something wasn't even on my radar, which was junk oils and processed seed oils, which drive insulin resistance, drive inflammation. And in my opinion, I think they're necessary to, as part of lowering carbs, you also need to lower the junk oils in order to really address it. And then for me, the third foundation of my pyramid was to eliminate grains. They contain a lot of carbs, but also I think I don't have celiac disease. I don't have gluten sensitivity, but I think there's a lot of people have low-grade inflammation related to the proteins in the grains. And if that's not enough, at least in the US, our grains, most of them are soaked in glyphosate, which is, toxic weed killer that's outlawed in 30 countries around the world for its health effects and cancer. So I avoid all grains altogether. I mean, don't get me wrong. I love bagels. I love donuts. I love cakes. But there's only one thing I love more than those, and I'm willing to give it up for them, and that's my children, because I want to live to
Yeah.
see them.
Yeah, and it's unfortunate, but some of these things, I mean, we talk about fasting and cutting down the carbohydrates, and the funny thing about that for type 2 diabetes specifically is that the rationale, like the scientific rationale, is so just blindingly obvious that it boggles the mind why doctors are not educated on this, right? I mean, you could look at a glycemic index, right? And certain foods will spike your sugars really, really high. That bagel, for example, will spike your sugar really, really high, whereas an egg will not. So why are we telling people to eat 50% carbohydrates? How does that even make any sense, right? It's like if you're, wet, then we say, go jump in the pool. It's like, why would you want to do that? Like, why would you want to eat foods that spike your glucose? Like, why don't you tell people to cut the carbs so that it just boggles my mind. Like, I just don't understand. And I think that's part of the sort of changing mentality that we're trying. I think that's what you're hoping to do with your book, right? So sort of get some of these, truths out there that are actually really just self-evident. So I love the title of your book. Maybe you can tell us about some of these lies that you're taught you were teaching. Actually, I was
Yeah.
taught, you were teaching.
Just back to that one point before we leave that, the notion of why don't we, if type 2 diabetes is carbohydrate toxicity, well, just stop eating carbohydrates
Yeah.
and you're done. Well, our trusted medical institutions, in the case of diabetes, the American Diabetes Association, is the US and ultimately worldwide authority on diabetes and recommendations. And I love on their website, you go to their website and they have recipes for type 2 diabetics, and they have recipes with sugar added. And their advice is just cover it with insulin. And but then if you look on the page, the sponsor that's sponsoring that is DaVita Corporation. And the audience may not know, but DaVita Corporation is a large purveyor of kidney dialysis machines for kidney failure, and the number one cause of kidney failure is type 2 diabetes that people get from eating sugar in their diets that this ad is recommending. I mean, a lot of people think that glucose, high levels of glucose is harmful, and it is. I mean, it's pretty clear. Glycation, hemoglobin A1C is glycation damage, but I think insulin in itself, there's a lot of evidence that insulin in itself is damaging, and you've seen it from the diabetes studies. If we control the glucose very well, but we have to give high amounts of insulin, then these chronic progressive changes in type 2 diabetes continue to happen. So we're treating type 2 diabetes by giving one of the things, insulin, which actually makes the disease worse.
Yeah, and for atherosclerosis too, right? There's
Yeah.
actually tons of data because I remember looking back at a pathology textbook when I went to medical school because I still had it right on my shelf. And it was from the 90s, right? And it was already talking about how insulin causes hypertrophy of smooth muscle, because if you look at atherosclerosis, it's not actually cholesterol sort of just clogging up the pipe sort of thing, right? While it's a great image, that's not actually what happens. It's more of a response to injury and hypertrophy, right? You get injury and then hypertrophy afterwards. And insulin actually plays a huge role in that inflammation and hypertrophy, the smooth muscle hypertrophy that goes on in these atherosclerotic plaques. I'm like, geez, back in the 90s when I was, looking at these all the pathologists were like, oh yeah, there's tons of effects that insulin's going to make worse here, right? And it's like, oh, so then why would we want to give more insulin? The patient that has more insulin, when you ask these simple questions, and I've asked this of endocrinology fellows and stuff, they actually have no answers, right? They were taught a certain thing, which is eat carbs and cover it with insulin, and they just repeat it on and on, right? And those are those lies that we get taught in medical school, but you think that they're true, so you never question them. And when you actually ask the question, which is so obvious, they can't come up with an answer because it's just too stupid, right? It's too like, don't eat so much glucose, right? So because
Yeah,
carbs,
the insulin itself is the problem. That's why sulfonylureas, which are
yeah.
bad because they raise insulin, whereas metformin is actually good, another drug for type 2 diabetes, because it basically lowers glucose, but it doesn't raise the insulin. That's why, I mean, I take metformin for longevity now after I stopped it for type 2 diabetes. But yeah, to your point, insulin, I mean, you wrote the book on cancer. It's the greatest book on cancer I've ever read. The Cancer Code, I highly recommend it if anyone hasn't read it yet. But insulin like growth factor, turning mTOR on with insulin, can also drive malignancies and that as well. And then we can look at Alzheimer's disease is, type 3 diabetes. There's an effect of insulin there, although it's not as straightforward, at least, but we're seeing it. We're even seeing it, of course, in mental illness, with people going on the ketogenic diets, reversing, becoming metabolically healthy. It's all tied in, at least tangentially to insulin at some level
Yeah,
too.
I think the hyperinsulinemia is really actually the key to the whole thing, and understanding it, because people call it insulin resistance, which sort of hides the actual problem. Because when you say insulin resistance, you say, well, what causes the insulin resistance? And that opens the field wide open. But if you say, well, the problem is actually hyperinsulinemia, then you come to the immediate conclusion that, well, hey, we just need to lower this insulin. Sort of like if you have hyperthyroidism, then you go, oh, I see. We just need to lower the thyroid hormone, right? It makes it obvious what you need to do. But yeah, insulin itself, there's decades of research data. There's just data everywhere showing how harmful hyperinsulinemia is. That is insulin, and everybody says, oh, like, demonize insulin. It's a normal hormone. It's like, of course it's a normal hormone, but it's too high, right? That's the
And
whole
that's why
problem.
lowering the cost of insulin, our politicians are saying, hey, we're going to cut the cost of insulin and make it more cheaper for people to pay for their insulin, which is good. But for type 2 diabetics, many of them, the majority, at least in the controlled studies, can reverse their type 2 diabetes, and in many cases get off insulin. So it's there.
Yeah.
I I have a question. I have a question for you. One of the things in writing this book about diabetes that came to me as a physician, I used to think of diabetes like I thought of like all these chronic diseases kind of erroneously. It was like an on and off switch. You either had diabetes or you didn't, and then there's some couple great studies that came out with looking at non-diabetic adults in America, and they plotted the hemoglobin A1C, which is, as our audience knows, the damage and also the diagnostic test in many ways for diabetes. And these non-diabetic adults, with aging, insulin resistance increased and hemoglobin A1C just got higher and higher and higher with aging. And so I'm now starting to think about type 2 diabetes and insulin resistance, but specifically type 2 diabetes, as sort of like gray hair. In other words, if I live long enough and if I don't die of something else, I'm on the path to type 2 diabetes, or at least many, if not most people are. And how does that inform my life? Well, for type 2 diabetes and also all the diseases, all these chronic diseases, I'm going to start choosing the lifestyle now that will begin making me metabolically healthy, because as we all know, these diseases don't start when the doctor says you've got diabetes or you've got Alzheimer's, you can't remember your keys. They start years to decades before the doctor makes a diagnosis. And if we wait until the doctor makes the call, we've missed a tremendous opportunity for prevention and even reversal and just living a better life. And that's why lifestyle is so important. Start now. Don't
Yeah.
wait until the
And I
doctor
think
tells you got something.
that's absolutely right. I mean, if you look at type 2 diabetes, I mean, I think of the spectrum as basically the hyperinsulinemia. So you get it. So if you look at the diagnosis of hyperinsulinemia, and they did this study called the Whitehall study, where they look back on those people who had, regular blood work, and then they look back at those people who had developed type 2 diabetes. And what they found was that, like, I think 11 or 12 years prior to that diagnosis, you could already see the issues, right? The insulin starts to go up. And that's the sort of beginning of the hyperinsulinemia phase. So you get the hyperinsulinemia. So you get the high glucose, and then the hyperinsulinemia returns the glucose to normal. So when you check the glucose, which is the A1C and the blood glucose, it's actually normal. But you get this compensatory hyperinsulinemia, which starts way before, like not even close. It's like 10, 12, 14 years before the damage is already starting. So by looking at just the glucose, we're almost completely missing the boat on early disease, which of course, like anything else, like cancer, like any disease, like you want to treat early because you want to know if there's a problem. So by the time that sugar actually starts to go up there, you're just you're already 10 years down the line of the disease of hyperinsulinemia. And, to me, it's like, insulin is one of these things when it's in very high doses, like when it's too high, you can clearly see the effect because we know it. We give people insulin as a treatment, and you see what it does to people. It makes them gain weight. Like, so obviously, if that's what causes it, then we need to lower it, right? And that's where cutting down the carbohydrates, intermittent fasting is super, super, super beneficial because they're both dietary cause like treatments to lower insulin, because if it's too high you want to lower it. And I've seen you mention before your mom was a dietitian, right?
Yeah,
So
yeah,
she was,
absolutely.
I mean, obviously the dietitians are good people. The problem is that a lot of the teachings, just like the medical teachings in medical school and so on, you and I, we're doctors. We know a lot of doctors. They're good people. They're not trying to be, they're trying to help. Like obviously they are, and the dietitians are the same. But the problem is when the people who teach the doctors have been influenced so heavily by industry, by pharma, that kind of thing. That's what happens. And so it's tough. It's tough to be that. I wanted
Yeah,
to ask you,
yeah. Go
sorry, go
ahead.
ahead.
No,
Go
I was
ahead.
just going to say, yeah, certainly the saying goes, the nutrition education is basically paid for by big food, junk food makers. That's why my mom would go to dietitian conferences, and their big McDonald's and Cokes would be the sponsors for it, and all. And just like medical education, sadly, is paid for by pharmaceutical companies. Right? What could go wrong, right?
It's actually a terrible problem, honestly, because the problem, like I think what happens, and you know this, but when you get these either pharma or big food to come in, what happens is they sort of distort the whole system. In medical education, for example, there are tons of doctors who get a ton of money from, various pharmaceuticals for whatever. These doctors are not bad people. I know a lot of them. But the problem is the sponsor of the trial has a huge influence on the trial results. And they've done studies on these, which is to say that if you look at a study that's funded by a pharmaceutical company or a food company, it's like, 7 or 8 times more likely to find a result, you know, favorable to that company. So this is the problem. So if you have drug companies doing a study on a drug, well, 9 times out of 10, no matter what the drug does, like it could be a sugar pill, but no matter what the drug does, 9 times out of 10, the study's going to say, oh, this drug is amazing. Same thing with if the, if the food companies are sponsoring the education event. So it's a massive problem. Then, of course, then they say, well, the studies show this. This is evidence-based medicine, right? But it's like, okay, but it's evidence that's been paid for by the pharmaceutical company. So that's where you get into these issues where medical education itself is a problem, which is why I think, your book is so important, because it's like the problems are pervasive. And if you don't if you just take everything at face value, you can't always trust them, right? I mean,
Yeah, I mean,
it's a
I
problem.
experienced it firsthand. My lab received millions of dollars in grants from drug companies, device makers, and the federal government to do studies and do research. But part of it was publication. And just like you say, the drug company pays you to test this drug. And at one point for us, there was even a clause that they said, when you write up this results of this test, we have first right of refusal. In other words, you have to show us the paper, and if we don't like it, we will prevent you from publishing it. And so, it's like, so only good news gets published about the drugs,
Yeah.
and only, the only people that pay for drugs companies drug research are the people that benefit from it. So it's not 100%, but it's by far most of them. And it's a very slippery slope.
Yeah, and I always get the argument back that, oh, we need these drug companies to do research. And I'm like, but that's based on the premise that biased research is better than no research. And I'm like, I'm not sure that's true, right? Because, I mean, it's one thing if if I said to you, oh, Coke did a study showing that sugar is amazing for you, you'd say, whatever, right? But if somebody else said this drug has been proven to be good for you because the American Heart Association says so, you'd say, oh, okay, I should take that drug. That's the exact same logic, right? The drug company paid for that drug. The drug company paid to publish those results. The drug company paid the American Heart Association or the American Diabetes Association to publicize, to get this out there. It's no different than a study that Coke's published a study saying sugar is great. And it's like, okay, but this is a problem. I think the American public deserves better. And it's such a problem. I know some of the people are like, people try to change it, but it's always hard to argue
Yeah, it's
with these
bad
big
enough when
corporations.
when the media and the trusted scientific organizations take a scientific abstract from a meeting
Yeah.
that says that fasting is bad, and suddenly it's headlines in the media, and I get people
Yeah.
calling me up and said, "Wow, I quit fasting. I'm glad I did that. I don't want to have a heart attack." And
Why don't you
that's
tell us
harming
about
people,
that? Because yeah, why don't you tell us about that what
Well,
happened? This was probably what, 6 months ago, or no, 3 months
yeah,
ago
yeah. There
maybe
was
it is.
it was a study. It was and correct me if I'm wrong, but I believe it was an abstract
It's an
from a
abstract.
scientific meeting, which has it has to be cleared by the scientific organizers, but it's not really a peer review process, and it's not a full paper. It's just an abstract that's submitted. It's presented at the paper at the program in the meeting, and this was seized by an organization. It wasn't the American Heart Association. It was
It
another.
was the American Heart
Was it? Oh,
Association. They
okay.
put
Yeah.
out, I think they put out the press release that wound up getting to all the sort of journalists and so on, right? Is
Well, let me ask you this. What is their axe to grind against fasting? I mean, this is it, it sounds like they don't want people to fast based on bad research here, but why did that happen, do you think?
I don't know. I think it was very clickbaity, right? So I think somebody at the American Heart Association. So to be clear, an abstract, there's it's the lowest form of research, right? So you have peer-reviewed papers, which usually have multiple authors. You spend, 6 months, sometimes a year, sometimes many years to do a paper like this. An abstract is something you get the medical student to put together, and it doesn't get peer reviewed. You present it at a conference, but there's usually like 1,000 of these abstracts, right? And it's really low on the totem pole. It's basically worthless. Like an abstract, it's not worthless because it's still research, but it's really, 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 really low down. Nobody's looked at it. If I wanted to say, oh, sugar is good for you, I could put out an abstract. You put it out there. 1,000 of these at every conference. So there's, if you have 100 conferences, there's probably like 100 or 200,000 of these abstracts that go out, and it's really not a very worthwhile paper. Tons of scientific errors in this sort of thing, and yet I think because that number right? So the AHA put out this number that if you fast for like 16 hours a day, your risk of heart disease, it was associated with an increased heart disease risk of like 91%, which is like an incredibly, like, that's so far off of what's in reality. It's not even believable. Like but is so clickbaity that I think somebody at the American Heart Association must have said, hey, we can get good press for our meeting here. I don't know that they had anything to grind against fasting. I mean, but I think it was just something like, oh, well, here's something that'll get people's attention. And it did. It went, I think I saw it on every news media had something on it, right?
Yeah.
And it was just ridiculous. Like the whole outcry was like ridiculous. Then you actually look at the study. And so as it got attention, people started looking at it. And it's like, wow, this is a real piece of garbage research. It's like the worst study I've ever seen in my whole life. I'm like, yeah, because it was an abstract. And it was garbage because it was meant to be garbage, but somebody seized on it and threw it out there. And of course, journalists are not scientists. They're not doctors. So they just take whatever the AHA says, right? So I think, I can't blame the media for saying what the AHA had told them, right? They're not doctors. But the AHA, like, you're doctors. Like, you're so hungry for publicity that you'd put out something that is a terrible, terrible piece of research. It's got tons of errors. The number is not even believable, right? So, so what they said is fasting for 16 hours a day was, increase your risk of heart disease by 91%. It's an association, but by the time they spun it, they made it causal. They said it was causal. If you did it, you would get like it, which is a complete error, right? And then they further said that if you fasted for like 14 hours, so keep this in mind. So 14 hours of fasting means you finish dinner at 6 and you eat breakfast at like 8 a.m. So you eat at 8 a.m. breakfast and you eat dinner at 6 p.m. And that would increase your risk of heart disease by 66%. Like, are you insane? Like, are you telling me that eating at 8 a.m. and then dinner at 6 p.m. is worse for you than every other risk factor on earth other than smoking? It's worse for you than diabetes. It's worse for you than, not walking. It's worse for you than being overweight. It's worse for you than everything else, right? A normal
Yeah.
eating pattern that everybody did in the 60s is going to raise your risk by 60. It's such a piece of garbage, right? But,
That
it's,
point you mentioned about causality versus association, that can apply even to peer-reviewed studies. You have a study
yeah.
that it's a correlation study. It's not a controlled study, so there's no causality can be inferred. And they say that, oh, red meat is associated with cancer. People who
Yeah.
eat red meat get cancer. And it's true, but also people who drive pickup trucks get more cancer, and people who go to rodeos have more cancer than people who go to, different, who drive people who drive pickup trucks are more likely to get cancer than people who drive Teslas. But it's not because of the car, it's because of the lifestyle. Same thing with red meat and other things, but it gets distorted. So I even see my colleagues and, sometimes even myself, I look at it and go, oh, wow, that causes that. But it doesn't. It's just an association, and it's really a
Yeah.
slippery slope. And the media has no clue, but oftentimes doctors get confused on it too.
Oh yeah, I have a good one for you. There's a study I saw just a few days ago. They said that if you have a wife that is 10 years younger than you, that is also
Okay.
associated with lower mortality. And it's like so the whole gist was, oh, then we should go out and get a young wife. Like, obviously not, because it's an association. It means that those people are probably more well off, richer. Like, there's something in that group who've married very young, probably second wife. Obviously there's something there, and probably it's socioeconomic status. It's the money that means that they live longer because they have better access to healthcare and stuff. It's like it's the same sort of stupid association. But yeah, it gets us into all kinds of problems. And I wanted to pick up one other thing you said about fat, the seed oil, the junk oils you're saying, and also saturated fat, because this is something that has been a staple of medical education and dietary education for years, that you should avoid saturated fat because it clogs the arteries and causes heart disease. So what do you think about that?
Well, the conventional wisdom is just what you said, but in my opinion, my thinking has changed, and I think there's solid evidence. It's not just because, Rob says so, or, my mom says so, or, my neighbor says so, but they're actually peer-reviewed studies, prospective controlled studies that can demonstrate this. But I think I'm more likely to get a heart attack from eating a sugar donut than I am from eating meat and saturated fat. And fortunately, the thinking about eggs and cholesterol has come around. So we know dietary cholesterol really doesn't have a significant effect on blood cholesterol. The question is, does blood cholesterol, what's the effect on heart disease? And I think even that's been exaggerated. There's a small effect, but as you hinted at, I think if we look at hazard ratios, they're much stronger correlations to what's going to cause a heart attack than my LDL cholesterol. Things like my metabolic state, my insulin resistance, my triglycerides, my
Yeah,
HDL. And look at smoking. Smoking is a big cause of heart attacks. And yet, what does that have to do with LDL cholesterol? it
exactly.
it it's a, so cholesterol plays a role, but I think oxidized cholesterol is, it's involved in it, but I don't think it's causal, which is really, to your point.
I agree with you because there's a lot of people who say otherwise. And to me, it doesn't actually make any sense, because if it's causal, then you'd say, okay, well, what are the biggest risk factors, right? So of heart disease, right? So do they affect your cholesterol, LDL cholesterol? And smoking obviously is big. No, not at all, right? Doesn't affect
Air
it barely in
pollution,
any
same
way.
thing.
Air
Yeah.
pollution, diabetes. So metabolic disease, does that affect LDL cholesterol? Barely at all. It affects triglycerides and HDL. That's part of the metabolic syndrome, right? And we all know that's super important. And in fact, but LDL, no, it's not part of the 5 things that make up metabolic syndrome. And we all agree that metabolic syndrome is probably the most important factor in heart disease, short of smoking. And then you look at, are there drugs that can raise your cholesterol? Sure, there are. SGLT2s, they raise your cholesterol and they lower heart disease. So it's like, okay, LDL cholesterol is going up by 20-25%, but heart disease is going down. So how can you say that's causal? A hormone replacement treatment decreased cholesterol 25-30%. So back in the day, if you remember, and again, this is when I went to medical school in the 90s. Hormone replacement therapy was purported to lower heart disease by 50%. And one of the mechanisms was that it lowered cholesterol by 25-30%. Now we know that it doesn't actually lower your risk of heart disease, but it still lowered your cholesterol. So what happened to all that benefit, right? Did we just forget about it? And it's like, absolutely. People just kind of started ignoring it. And then, so it's like all this data that suggests that, hey, LDL cholesterol, well, I agree with you. I think it's a factor, but a small factor. And I'm not sure that it's actually causal. What about this whole idea of eating saturated fat? Because that was one of the other pillars that we all got taught in medical school too, that we should eat less saturated fat. That's why we weren't supposed to eat butter, right? We were supposed to eat margarine.
Right. I believe saturated fat is healthy, and I think this question is really fundamental. It sounds like we're in the weeds, but it's really it's at the it's a hinge of American or global nutritional policy. That is, of the 3 macronutrients, we're going to keep protein the same, and so we're going to vary fat and carbohydrates. And if we go to a low fat diet, we have a high carb diet. We go to a high carb diet, we have a low fat diet. And for years, we've been recommending a low fat diet and eat a lot of carbohydrates, and that doesn't work. If we want to, or if we go to a higher fat diet, we use junk fat, which the American Heart Association recommends because they were funded by Procter and Gamble, which made Crisco. And But to their point, canola oil, corn oil does lower LDL cholesterol, if no question about it. But as you say, LDL cholesterol doesn't seem to have a big effect. Most people have heart attacks and entering the hospital have normal cholesterol, and
Yeah.
and then the all-cause mortality studies on the statins, of course, too. You lower the LDL cholesterol,
And I'll
heart,
point out too that
yeah.
all of those statin studies were funded by the statin maker, except for one. So I don't know if you remember, but there was this study long, long time ago that the VA actually did because they were the only ones who would fund this. I think it was one of the All Hat studies. It was the only one that was not funded. And guess what? They didn't find any benefit to that.
Ouch.
I know. It's like, but people forget about it. They say, "Oh, it's consistent. It's consistent." It's like, yeah, every single. It's like saying, "Oh, I did 5 studies by 5 different soft drink makers, and they all agree that sugar is good for you." Right? It's like, oh, well, you had 10 statin makers who did studies that told you that statins were really good for you. It's like, okay, but like, doesn't the American public deserve better than that? Right? That's what I always think. Like, there's all this funding, there's all this money that goes into healthcare, but we actually need good information, right? It's this sort of thing is just very harmful. And I think that the saturated fat question is very interesting because it's what do you feel is really bad about the sort of seed oils, the sort of junk oils you call them? What makes them so bad for you?
Yeah, well, I think two things. One, they drive oxidation just chemically, and they're in all salad dressings, they're in all, most junk foods practically. They're even in hummus and things you think are healthy. They have canola oil because why? Because people aren't trying to poison us. It's that they're inexpensive. They're subsidized in the US at least by the Farm Bill. So corn and soybeans are artificially less expensive. But it gets worse. In 1990, of course, McDonald's and Burger King famously switched out beef tallow in their fryers, which was a healthy saturated fat, which is stable at high temperatures. And they switched out for inexpensive corn oil and these seed oils, which was actually paid for by science in the public interest by a billionaire who funded this. And the idea was to make people healthy by getting rid of saturated fats. And what happened as a result of that, all over the world now, essentially, with few exceptions, all fryers use these seed oils, which are unstable at high temperature, and they break down to relatively toxic compounds, which, if they don't change the oil in the fryers, they last forever. You can put it in your car and use it as gasoline, which it was originally developed for, machine lubricants for World War I's German submarines. But those are the problems that I think Kate Shanahan, shout out to her, has done a huge amount of work on that.
Yeah.
And yeah,
And I think I remember Zoe Harcombe, a researcher in the UK, also
yeah,
looked at saturated fat because saturated fat, of course, we live in this era that we call evidence-based medicine. So if you say, okay, saturated fat is bad for you, you're not supposed to just say that, right? You have to back it up with evidence. And, this idea that eating saturated fat, butter, beef tallow, that kind of thing is bad for you should be backed up with evidence. So there's tons of evidence, but none of it shows that eating saturated fat is actually bad for you. It's like
it's not funny. I'm sorry. I shouldn't be
it's,
laughing. It's not funny because
I
people are
know
dying as a
people
result of
are,
this. But yeah,
I know, it's crazy. It's crazy that we accept this to be true, yet there's actually
yeah.
zero, and it's not that they didn't do it. They've actually been doing these studies since the 70s. So you're talking about 50 years of nutritional research, all of which have provided a grand total of 0 studies showing that saturated fat is actually bad for you. Well, doesn't that tell you something? Like, seriously. And the thing about unsaturated fats, like these vegetable oils and so on, first is that they're highly, highly, highly processed, right? It's not a natural product. Like you have olive oil, which is also unsaturated, but you take olives, you squish it, it's pretty natural. animal fat like butter. We've been eating that for millions of years, saturated fat, but it's natural. It's a natural oil. Whereas, canola, like nobody ate canola before. It's a totally new crop. It's highly processed. You have to, take sunflower oil, corn oil. You have to do a lot to them other than just squish them, right? It's highly processed.
It's
And
some, yeah. Go ahead.
yeah, and the thing is that the polyunsaturated fats are unstable, as you said. That's their chemical nature, right? Because saturated fats are saturated with hydrogen. You can't stick any other, oxygen molecules into that fat because every sort of available position is saturated. So these oils are not chemically reactive, as opposed to those vegetable oils that we were taught was healthy, but they're actually highly unstable. So you can get oxygen in them, which causes them to be oxidized, which causes them to be massively inflammatory because it's not natural, right? So when it's not natural, it goes in our body and our body's like, yow, and it starts to, just like when you get a cut or get an infection, it gets inflamed. Well, this is like a foreign sort of substance, so our whole system gets inflamed. And that's just their chemical nature. There's nothing you can do. That's why they go rancid, right? These vegetable oils. They're unstable oils. And so how is eating this unstable oil supposed to make us healthier? And it's like the whole thing, like once you start digging into this whole saturated fat, polyunsaturated fat story is like, wow, there's a lot here that hasn't been told to us. And yet we believe it just because we've been told over and over again without evidence, why this is. It's like, that's a crazy, crazy idea.
Yeah, I mean, here you have the American Heart Association saying canola oil is a heart healthy oil, and they put it on the package of cereals and things like that. But it's something about the seed oils that, like as you say, high omega-6 make them unstable, pro-oxidative. But then the fruit oils, like you mentioned, olive oil, which is not a seed oil, it's from the fruit of the olive around it, or avocado oil. Those are healthy for, they don't have the same problem, but it's the seeds that you're concentrating literally thousands of seeds, and cotton seeds were junk after the cotton gins were developed in the 1800s, and they had all these cotton seeds they didn't know what to do with, and whale blubber was falling out there was less and less whale oil, so they made cottonseed oil and as a lubricant, and then they figured out, hey, and corn oil based things too. They figured out, hey, people will actually eat this, and then it was it was promoted as a healthy alternative to what are actually healthy animal fats and healthy plant fats.
Yeah, crazy, crazy. This whole field of nutrition, I mean, so many misconceptions, which is why I think, your book is very important that, hey, this is not just crazy people on the internet talking about it. These are, professors and doctors and that have looked at this sort of thing and said, wait, why are we doing what we're doing? Like, let's think about this more deeply rather than just parrot the things we had been taught. Because obviously the things we had been taught, a lot of them turn out to be wrong. There's so many examples. I mean, hormone replacement therapy was huge until, we figured out, yeah, it's not good for you at all. So then we had to change. But, 50% of women were on hormone replacement therapy like 20 years ago. It was a huge thing. Margarine was supposed to be great for us, right? It was at least 2 decades worth of, oh, don't eat butter. I can't believe it's not butter and all this stuff, right? Turned out that those margarines were full of trans fats. So to prevent heart disease, we told people to go from butter to trans fat laden margarines, which would actually kill you, right? What a disaster that was, right? So the whole thing, this whole low fat paradigm was crazy. So again, there was, no data whatsoever that eating less fat would prevent heart disease until the studies started to come out in the sort of late 90s that, hey, these low fat diets were just killing people. There's the Leon study and there's a bunch of other studies. And that's where we switched to sort of this Mediterranean diet. A lot of those things were higher fat. So a lot of these things that we were taught without any scientific evidence turned out to be not true. And that's why we're supposed to demand evidence, yet we don't, right? We don't demand the evidence that we should get from things like, saturated fats, intermittent fasting. There's more data now on intermittent fasting, on these oils. So yeah, great book. I encourage everybody to get it. And thanks. And if people want to follow you, where can they find you, Robert?
Oh, yeah. My website is robertlufkinmd.com, and I'm active on social media. So please say hi. And yeah.
All right, perfect. I think we're good.
Great. Thanks so much, Jason. This has been a blast.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.